increased the risk of suicide at 29.
I don't believe there's
On Zoloft and suicide.
this arise and suicidal life.
When you get your medical degree, or board survey, have babies.
Reproductive psychiatry.
There's an annual, you're a resident. Have you attended, since you got the ability to prescribe these medicines to people?
I have not attended a symposium
Have you attended anything?
of research
You were going, what does that mean?
and benefits of treatment. Understands what you're saying.
One of the side effects was, did you tell her that? No, you are giving the patient severe trouble sleeping.
Doesn't cause severe trouble sleeping.
Well, that's what she told. Let's say. Anxiety.
Some
To register one with over 500 extensions to choose from. Take your idea online today.
Sparklings. Shop now. Limited units available.
consensus among women.
Plus, your observation, now with the use of RIs,
Arise.
4-year-olds are down, describes this, no psychiatric. It was 25, that increased up to,
Were to increase it.
right?
I think it's
And she didn't want a month later. Right? And then you tell her after a week to increase it, and she doesn't take that medication.
yes.
And did you,
I had met with her decision to
next time you met her, and did you recommend that she question when you take the Zoloft?
taken it 1 week prior.
And she told, right?
She felt all. She did increased anxiety.
In fact, the Zoloft had on Friday after, correct? All of you psychiatrists. You then told her to stop.
Yes.
What does it mean to titrate something?
To,
An SSRI
but if it
on an SSRI.
stop it immediately.
Another drug? October 28th.
I met with her the 21st.
Tell you.
How she was.
So I'm telling this, Jerry,
Something else.
something else. I'm just
I
asking.
gave her my brother.
She's a vascular system. Zoloft, anxiety by and side effects, right?
It is disappear. Yes. Yes.
To know. How about hyper?
With that.
That's what's used to,
No.
which is not knowing what you have no duty to know, and ignorance, which is you don't know what you should know. Is that fair?
Yes.
So, did you ever gauge Lindsay's?
So that would expect her to know.
Is it important to us prior delivery of health care
They're usually.
people in
I her prior.
Boston?
Yes.
Yeah.
Yes.
So what is it?
Go by exactly the common ones.
The side effects?
If they were anything,
SRI after having got that's something that would
yes, but she
whether or not they're severe is you just wait for bipolar. What's bipolar?
aggressive episodes.
He has a difficult birth, not prescribed SSRI.
Birth does not. It's not a contraindication to an SSRI.
So after she had her second child, she took SSRI. She came to see the third child. Not easy stuff for somebody to. She's telling you that she had meant the second.
Document the specific side effects.
So if someone comes to you as a person who is in postpartum and is after her,
Would have written them down.
no, not what you would have done. What did you do? No, go ahead.
I would have written them down.
What did you do?
I wrote that she had side effects.
What are they? You prescribed that she.
Looking at
Well, the period of time. So these difficulties, you told her to stop.
yes.
Did. And that's why she was overwhelmed. What did you do?
Hard to pinpoint exactly what I said in a span of a number of different visits.
Did you indicate that there's information on the website that if a person has an emergency that they should do something?
I did, and I advised her the same.
So basically, if one of your patients becomes suicidal, and on that note, did she tell you at that point, up to November of 22, that she was dwelling on suicidal thoughts?
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records
right
to see
ahead.
when she first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
Is thinking about the storm and is dwelling on the storm, almost in fear of the storm, right?
Projection.
No. Isn't it?
I guess.
So when she tells you that she's, and I don't want to put words in your mouth, what did she say? She's having suicidal thoughts, or what did she say? All close to it?
She denied having suicidal thoughts, but felt that she was getting close to eventually having those kinds of thoughts.
To kill herself.
Yes.
And how frequently were the thoughts?
I'm not sure exactly how frequent they were.
Did you ask her?
It's
sorry?
very likely that I did ask her the frequency.
Isn't that right?
Yes.
Distress, and she's close to having suicide thoughts to kill herself? That's important, isn't it?
Is fearful she could become suicidal.
And she told you, and I imagine, or you asked, how frequently these thoughts were.
I don't have it documented how frequently they were, but that is a question that...
Not speculation, suicidal thoughts.
Sorry, but it's what I said before, that that she denied having them and she wasn't having...
So she, your symptomology, has other little kids in I'm having suicidal.
Not a reportable condition.
All right. So basically, we know that she was close to having suicidal thoughts to kill herself, whatever that means. We don't know how frequent.
At that point,
through the television.
psychotherapy, providing...
So, listening to the patient, all the treatment that you had provided prior to that, all the symptomology that she had, and insomnia, and anxiety, and all of that she's close to having suicidal thoughts, that would, I imagine, impacted her.
Yes.
So what did you do with this psychotherapy?
So I provided emotional support and validation and
What does that mean? Validation?
encouragement.
What does that mean?
Something like, I understand this is a very difficult time. It really, it varies on the individual.
Sure. How about Lindsay?
I don't remember the exact therapeutic words that I used.
Okay. How long did you give the therapy? Validation and all that stuff?
I don't remember exactly the duration.
Maybe about 10 minutes?
Maybe.
Through the television, right?
Through the
So,
computer.
as we pointed out, you tell the people that come to see you, when I say you, I mean collectively Astor Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right?
Or go to the emergency room as quickly.
Did she call suicide hotlines?
I was not aware that she did.
Did you ever ask her?
I I don't think I specifically asked that
Not
question.
specifically. Did you ask her anything? Did you beat around the bush maybe? You ask her anything about suicide hotlines?
I,
In that time frame, not once, but twice, and was turned away? You guys were in the front line of this, aren't you?
it does surprise me, yes.
It does what?
I don't think that I did.
Yeah, I understand. You're a doctor. You were trying to do the right thing. You obviously, this is just... She continued on with her treatment. What was the next medication that you put her on? The October 26th date? Is that right? When you prescribed Ativan?
I prescribed that on the 21st.
Sorry?
I prescribed the Ativan on the 21st.
All right. Did you prescribe anything on the October 26th appointment? Would you agree?
Buspar or Buspirone?
BAR? You ever heard of that?
No, I haven't.
Okay. And would you agree with me that there are a number of side effects of Buspirone?
Every medication has side effects, but
Okay, so my question is pretty simple. Buspirone, you mentioned it. I'm asking, any side effects?
rarely some upset stomach, but it's generally a very, very well tolerated mild medicine.
And do you recall
Yeah, she was taking some of the Ativan.
some Ativan, right? Did you prescribe that to her?
Yes,
When did you prescribe the Ativan to her?
the 21st.
She was taking Benadryl, it's like over-the-counter stuff, or whatever, you take it as required. And you didn't document how much she was taking, right?
It's only available as one dose over the counter.
Okay.
She did.
Did you ask her?
I think she was just taking one of them.
You think? Did you know that Ativan and Benadryl are contraindicated, that they can have a serious impact to the central nervous system and depressant effects?
Yes, but can I explain that when they say depressant?
Excuse me, the answer is yes, right? Is the answer yes?
Yeah, if the answer is yes.
Okay. Well, I can't say yes to that.
And on October 26th, little thoughts. How did she deny that? Is that
Suicidal ideation.
suicide or being close to it? The last time you spoke to the woman,
Yes.
and you're her doctor, right? And she says no, and you checked the box, told me that you were close to having suicidal. What did she say?
That she was.
And then there was some therapy. Roxazine?
That was the same visit.
Told you that she was taking over the, right?
You asked me about that. Yes.
And then,
Yes.
and what is the, so it's, okay. So, Sarai, and then you prescribe, what's hydroxyzine?
Assist.
Okay.
We had tasks in one app, docs in another, meetings somewhere else. It was a game changer. It's not just AI chat. It actually runs workflows inside
Medications and keep a diary of any side effects that she has. Meds, if you're having an effect, you should. Now, you'd agree with significantly worse. Note that she was, had, and worrying.
In the couple weeks, symptoms were significant.
Use the word brain fog, right?
It's a subject. Maybe it's hard to think. You're thinking.
Suicide. Insomnia.
I think he's going to get to that. Go.
October 26th, heading into November 2nd. Meeting. Talk about brain fog. Did you, she's telling me, right? Telling you in the brain fog. So you,
Patients,
what were the symptoms? What is it, medications that you would put her on?
sometimes it attributed to.
Right? You prescribed Ativan.
Sorry?
What was,
Objection, if we could just have it.
I'm
she
sorry.
already objected. He
So when I said you could, yes.
and when was the next?
Well, I saw her on the 20th. I'm sorry.
Okay. So I was hesitant to use the medication
Abuse bar.
and asking you to give her the drugs and told you advice interfering with sleep. Any thoughts of suicide?
Myself.
Right. And there's a distinction worrying about as her doctor that she.
Appointment.
I'm talking about thinking about suicide. That she told you that she was
Her first visit.
that period, however long it was, thinking that they might be safer. And I quote. Did you recommend that she take Remeron? That mirtazapine, as far,
Yes.
and you did not feel that that would be an appropriate medication for her to take at that time?
It was a very reasonable option, but we didn't decide to.
Decision as to when to start a drug?
The patient's there to ensure that.
Was at that time that.
Yes.
And did she tell?
She told me that it was because they
Yeah, but so were you, right?
not a.
Doctor or nurse practitioner that she was seeing?
I think she said
Nurse Gelada advised that, in fact, and at that appointment, right?
I think I had told her
What does that mean?
she should reduce her dose by.
Do that? She didn't.
Well,
Trying to give the jury. So, did you know that she had been or had when you were seeing her on this meeting?
after that.
Okay, as she went to the ER, they making it to your knowledge as her doctor.
They ultimately discharged.
Was she put on any medication? That the records from South Shore perinatal close to suicide, anything?
I did not have access.
Seriously?
Objection.
I did not have access to them. No.
And you could have got the records.
Provided all the relevant information about
She sees and she's seeing.
the medicines specific. It showed me she was capable.
Husband Pat.
I think it
Guy was
was.
living on the computer screen, right?
I think it was.
Probably a good spot to stop.
just a simple conversation. Head to arrow.ai and start by describing your business. Click Generate. Then it serves up a homepage, a logo, brand colors, brand fonts, the whole shebang. Now you've got
Jury?
Your Honor, for the purpose of the record, read yours.
All right. Thank you. Mr. Ray.
In front of you, I believe, interval history. Decided to start Zoloft. It says, and she then increased the dose you on the computer screen.
That she felt awful, worse when she increased the dose of healing. She was more. She had some mental
level.
Anxiety was real. Overnight, doesn't want to be alone.
Patient on your hands at that point, right?
I gave her some therapy.
Great. And again, I apologize. You have to keep your voice up so people. What did you do? Just talk about
Of them to discuss. And yes.
Did she? That she had to have her mother come and stay with support. She was coming to stay.
How long? But yes.
Did you bother to ask her? Do you know how long?
I don't.
You know that she ended up at the Zoloft and you would monitor closely.
Okay, so that's monitoring.
Next day, is that correct?
Yes.
Recommended that she try fish oil and to look into what's called Zolrest.
A treatment for postpartum.
And if she could participate in the program.
It's done and how to do it. It's not really an easy medicine that I can just start. It's infused through an IV in a hospital.
It's a 60-hour infusion, about 2.5 days of infusion, and it has to be on. And did you ever recommend that she do that?
Recommendation, because that's not the pharmacy.
Well, no, obviously it's for 60 hours or 2.5 days.
Look into it.
So what happened?
Immunization program at the hospital that advised her to discuss it with them.
Is this Women and Infants Hospital? Did they make reference? Did you ever look at them or even online?
I never had access to them.
Why?
I don't have access to. I don't work there.
Records. How did you do that?
Didn't seem necessary.
Walk into that place and say, hey, I'd like some.
How it works.
Jurors are looking at the records. You check appearance, speech, things of that. Judge, jurors. Paranoid of getting suicidal thoughts and something bad happening. Doesn't want to be alone. What did she mean by that?
Well, those were a lot of her words.
Right. Isn't that a concern?
The feeling like something bad might happen.
Stay with them?
Yes.
How long? What is she doing?
My office, so I never spoke with them.
They never called your office?
They never called me or sent a message.
Do you think maybe it would be real? Make a phone call yourself.
Parents.
So while she is telling you about the medications and the mental illness that she had, okay, on the television, on the computer, and you can pull up your record. And if you look again at the interval history, this is when she indicated that she's back to where she medication. Is that right?
Yes.
And then you started her on Ativan, as we talked about, right?
Yes.
And then you started her on the Buspirone, right?
Well, she had already been started on the Ativan, and then we added the Buspirone.
So my question was, you started her on Buspirone, right?
Yes.
Okay. And also you added hydroxy. Discuss side effects with her at that point?
Yes.
Pregabalin.
Yes.
What did you tell her about Remeron and pregabalin?
I don't think I went into any detail about those medicines, just that those might be things to consider in the future. That was her. I think that was just a therapy appointment with a different provider.
Would that be Jennifer McAllister?
Yes.
So it's a different provider in the sense that she just, they did a suicide assessment, or she did, right, McAllister?
I wasn't there.
Well, I know you weren't there, but these are medical records that have been introduced into evidence that the jury's going to have in the jury room.
Objection, is that a question?
I'm sure she assessed
No,
for
no, no, look
suicide.
at the record, please,
Where do you see it? Sorry.
where it says suicide assessment. There's only 4 pages for October 31st. Well, actually, there would be 8 because it's 2 sides.
So that is the assessment that you go through. If somebody reports any thoughts of suicide, then you ask those questions, which go.
As a psychiatrist, that she's got suicidal ideation, worried about suicide, worried about killing herself days before October 31st, and a suicide assessment was done by McAllister, right?
I wasn't there. You would have to ask.
Did they do a suicide assessment? Did she check off the little boxes?
I'm looking for that section. That patient denies suicidal or homicidal ideation at this time.
Okay, so again, this is on October 31st, right?
Yes.
The patient, within a period of a couple of days and meetings with you, that McAllister has access to, has reported suicidal ideation and fear and dwelling about killing herself and afraid of those thoughts, right?
Clear. She had voiced those concerns.
Right. So as a result of voicing those concerns, is it your understanding that McAllister did not reported that she wasn't suicidal?
It appears that she asked about suicidality.
Right, you already told us that. I'm asking you about, excuse me, she's not,
Hold on.
was not suicidal when she spoke to McAllister. I'm asking you about the suicide assessment for the 3rd time. You see it in front of you?
Yes.
Okay. Can you tell me, did Lindsay answer any of the questions? Yeah, 3. Done by McAllister.
I don't see anything written here.
So was there a suicide assessment?
I don't know because I wasn't there. I don't know what the
And
conversation
you don't know from
was.
looking at the records, right?
From looking at the records, I don't see evidence of additional suicidal questions beyond asking if it was there or not.
So, the suicidal assessment, doctor, is in the medical records. It consumes almost questions like asking, have you felt life is not worth living? Is death something you thought about recently? Are you dwelling on that? What leads up to the thoughts? What are the thoughts? All those questions, right? For 4 pages, right?
Yes.
And there is not one notation indicating that.
Correct. But it looks like it was asked in other ways.
Yeah, okay. November 2nd. Oh, it was asked in other ways? Is that what the little checkbox where it says denies suicidal ideation?
Can I read something that she
You
wrote
have
in the note?
indicated repeatedly that she denied suicidal ideation, right?
Yes.
Okay. The suicidal assessment.
Suicidal assessment, yes.
As a psychiatrist, not a psychologist, I think we talked about the DEA number. You're prescribing these SSRIs and antipsychotics and antitropics or whatever they are, and it's important as to the metabolism of your patient with those drugs, isn't it?
Yes.
Okay, keep your voice up. What does metabolism mean? So how is the medication that is in the, how the body's breaking it down?
Testing that we do to understand that.
How about a blood test?
It's not done for that.
Metabolism of your patient, of your medication. About the metabolism, I'm not talking about genetics, metabolism rate through blood testing, right?
Not in the way that you're describing.
Okay, what way would it be?
There is genetic testing that can give information about metabolism.
Like what?
And might have it have the genes for it.
Forgive me, I'm having difficulty. Who's going through to understand that, would you? Why?
Or not, you can test someone, which is great, but does things, it does not yield meaningful clinical information, so it is not commonly done.
What is the Cytopro P4-50 system?
That's one of the enzymes that I'm talking about.
So
It's not in the way that you're describing. It doesn't
all I'm
tell you what
describing it is that
medicines.
it's a test.
Again, one at a time. Finish the answer, and then you can ask follow-up. Go ahead, Doc.
Yes, this is a test that is done, but it doesn't tell you what medications a patient will do better on. It's not useful in that way.
So what's it useful for?
I mean, I don't find it terribly useful.
How long has the Cytopro P450 system been in use in your field?
I'm sorry?
How long has the Cytopro P450 system been in use in your field, psychiatry?
Well, it's an enzyme in the body.
Well, I know what it is. I'm asking you about the system, the testing. How long have they been using that?
The genetic testing, maybe a
whatever
few
it is.
years. It's very new.
Very new. Test to determine the breakdown of psychiatric meds in a patient's blood, correct?
It exists, yes.
It exists. Well, it exists, but you didn't use it, right?
It would not have made a difference
In what? In your opinion?
in her treatment.
Because you go by the checks in the checkbox and what she self-reports, right?
No, not just the checks in the checkbox.
Oh. In any event, tell me about the thyroid.
The
Tell me about the
thyroid?
thyroid.
It's an organ in the human body that regulates hormones.
And what, if any, import and impact do thyroid levels have on your evaluation of a woman who is in the throes of postpartum depression?
They don't.
What is the purpose of a test to determine the thyroid levels?
Well, you can test something like the TSH.
Well, I don't know what a TSH is. I'm sorry. What is a TSH?
Thyroid stimulating hormone.
Okay, thank you.
That's something that can be tested typically by maybe a PCP, primary care, or endocrinologist if they have concerns about